Well, my name's Karen Wood, and in August of 2019, I went for just my regular annual mammogram. And soon after that, I got a phone call that said, Miss Wood, we have just a little concern. We want you to come back in and we'll do an ultrasound. Quickly, I found out that there was a concern, and that led me to a biopsy and then a diagnosis of breast cancer.
My name's Randy Hondras, and my wife and I have lived here in Carteret County for over 20 years. We're permanent residents. 2 years ago, I got diagnosed with a rare form of lymphoma.
I'm a 2-time cancer survivor now, but the most recent was stage 4 Hodgkin's lymphoma.
I live down East Carteret County, Cedar Island, born and raised there. In 2020, I got diagnosed with rectal cancer. After I went to the emergency room, we got a colonoscopy and found out that I had a tumor in my rectum and that it was significant size. The oncology team here did some tests and we had a plan together.
I'm Dr. Kyle Rustoven. I grew up in Florida and went to school at UNC. I finished my training in 2010 and moved to Eastern North Carolina. I was practicing in New Bern for 5 years and had the opportunity to break off and start my own practice here in Morehead City in 2014. 2003 is when I selected to go into this field, and shortly after that, my father was diagnosed with prostate cancer and subsequently developed metastatic prostate cancer. He ended up dying of his disease in 2016, but it was a really influential thing for me seeing his process on the family member side, and it's really motivated me in the period thereafter.
We are in an area that is growing really fast, and we are getting our fair share of patients that need care here, and that number of folks who need care here is increasing.
At present, we're currently treating roughly 3 times as many patients as we were 10 years ago. And our facility was built during the time period in which it was appropriate for the patient volume that we had at that time.
Our cancer center expansion is a response to that need of those patients coming in.
So this new facility means quite a bit to the hospital and to the community. It allows us to treat the community that we serve and keep the local people from having to travel outside of our community, which puts a burden on them and their family. But we know that we can treat a lot of good things, especially with our wonderful oncologists that we have here, both radiation oncologists and medical oncologists.
Knowing that you have cancer is tough, but when you have a team around you, friends, family, and the care providers, it makes it so much easier.
I really cannot put into words how wonderful our staff is. They love each one of these patients as their own.
I see parents of patients, I see children of patients who literally might live down the street or live next door to me. In such a tight-knit community that we have here. It's very fulfilling.
When I went in Carteret Healthcare in the Cancer Center and met Dr. Loynes and the staff there, I knew that I had found my home for my journey of my cancer treatment. They became like family to me, and I knew they were taking care of me, and they were working with my schedule so that I could continue to get up and go to school and work every day, because that was part of my wellness plan. I wanted to have that normal, everyday life.
I just like taking care of people, getting to know people, understanding, their lives and what's important to them. I'm proud of what we can do here and what we can provide here. And I think people can get good care in Carteret County coming to see us.
I've been getting regular PET scans. However, the most recent scan indicated that I needed some radiation treatment. And rather than going back there or to another hospital, I elected to seek treatment at Carteret Healthcare. So I went and visited with them, and then it became very evident that's where I wanted to have my radiation treatments. So I had a series of 18 treatments, and they ended on January the 5th of this year. Since then, I've had a PET scan, and it indicated that all of the lymphoma that was targeted during that radiation treatment had been resolved. To say it was a success would be an understatement.
It's so valuable for patients to be able to have high quality cancer care close to home when they have this appointment every day that they have to attend. And you can just imagine for someone living in Carteret County, if they had to go up to the Raleigh area for treatment every day for weeks on end, how much of a burden that can place on the patient and families, and how much extra stress in terms of time and resources that can create. So having good cancer care close to home can mean a world of difference for patients and families.
If I had not had this facility, I would have driven over 3 hours every other week, which would have been a very big hardship on my family, but specifically my children, because they wouldn't have had their mom for, days for me to get treatments. And there's more people in this community that would face the same hardships that I would have faced if we didn't have a facility here in this county.
Our goal is to have you come here, live here, get your care here, get your cure here. That's the goal, to be a definitive cancer care community location.
Going there for my treatment was my answer for what was best for my family and myself.
I'm pleased to have somebody like Dr. Rustoven here in Carteret County. He and his team were great. I think I had the best care I could have had. The results speak for themselves.
Thank you is not enough, but thank you can go a long way towards recognizing all of the efforts and all of the donations that have helped provide a very vital and necessary facility for our cancer patients here in this county.
That's true in Carteret Healthcare. That's true here. That's all I've had is great nurses and great doctors the whole time. And I feel like when I come in there, I feel like I'm family, and that means a lot.